Well, kia ora koutou katoa, warm Pacific greetings. Thank you, Prime Minister. It's nice to be on the call with you all today. Just a few introductory comments from me. It won't be lost on you that the majority of the people involved in the current outbreak in Auckland do identify as Pacific. And so right from that very first case being identified, as a ministry, we've been working very closely with our Pacific colleagues in the District Health Board, and obviously Margie Apa, Whapuria Margie Apa is the Chief Executive of Counties Manukau as the lead DHB Chief Executive across the Auckland region. We have our Pacific team in the ministry, and on the call you may see Geraldine Clifford-Lidstone, who's our Pacific Director in the Ministry of Health, has been as well as with obviously Pacific ministers and Pacific agencies across the Auckland region, both health and social, to reach into this community and of course to ensure that they have what they need. And I have to say, not unexpectedly, the response has been fantastic. We found early in the year during the first outbreak in Aotearoa that the Pacific community had the highest rate of testing by population in the country. And I think we've seen once again this time around their willingness to really support the efforts to get that high testing rate, to not only ensure that they are identifying if there are any cases within the Pacific community that we need to support, but also to support the wider population effort. And it's been fantastic to see that. So I just want to thank you also for the part that you have all played in helping to reach those Pacific communities, and a great opportunity today to support your work, and look forward to answering any questions you might have.
Thank you, Dr. Bloomfield. My introductory comments will be relatively brief. I want to acknowledge that alongside the incredible work that's been done on the ground through, as has been already acknowledged by Dr. Bloomfield, of the likes of Voya Mark Goshi, Whapuria Margie Apa. Of course, we've also had those working in our primary health, the whānau, those in South Seas who I had the chance to visit not so long ago, who did an incredible job reaching a wide range of Aucklanders in our first outbreak, and continue to do incredible work for alongside the response on the ground. So my thanks really go to them. But also I do want to acknowledge the work of Ōpiro William Seal and also Minister Salisa, our Associate Minister of Health and our Minister for Pacific People. It's fair to say I'm in more than daily contact with both, and also Minister Salisa has been part of our daily briefings with the All of Government Group and the Ministry of Health to make sure that we are getting on the ground feedback around everything from are the testing stations in the places they need to be, what work do we need to do alongside our church and community leaders to support them and the communities they serve, and very, very practical feedback around the way we need to alter our response to serve the needs of those who have been greatly affected. The final two thoughts I just wanted to share is that one of the reasons New Zealand has taken a go hard, go early elimination strategy is because in our view that's the way that we can best protect the health of all New Zealanders, and at the same time try and look after the wider well-being economically as well of all New Zealanders. We have always had in our mind the impact that COVID would have on all of our population, including our Pacifica communities. For me, our strategy has only been reinforced, and why it's so important has only been reinforced by the second surge that we're experiencing, and why it's so important that we continue an elimination strategy. And finally, my last word of thanks is to every single member of our community who has been tested, including those first individuals who helped us identify that we had resurgence in New Zealand. Had they not been tested in the way that they were, we would have been dealing with a much larger outbreak than we have. I used the platform today that I had to call out anyone who vilifies or discourages testing against anyone, to anyone who vilifies anyone who has COVID-19. These are in fact the people who have ultimately served to protect New Zealand, and I will very, very strongly defend them. So happy now to take questions. Lisa, I see you've written one on the group chat. I wondered if you wish to share that question.
Yeah. We're just really interested in, as I'm sure is priority for you guys, in the Ridges case and its connection to the Emmanuel Cook Island Church, and what you guys know around the confirmed numbers there, because that's the case that everyone's clearly really concerned about as a potential second cluster. What do we know about? I mean, it was said that there was 5 confirmed cases, but we weren't sure which were particularly linked to that church, if any.
I'll let Dr. Bloomfield.
Thank you, Prime Minister. So none of those confirmed cases today are linked to the Emmanuel Cook Island Church. So far, all the testing around the close contacts and anyone who may have had contact with that worker, both in the workplace or outside the workplace, the worker at Ridges, all that testing has returned negative so far. So that's, I think, very encouraging. Of course, those who are close contacts remain in isolation and are symptom monitored on a daily basis. And if they become symptomatic, then they are retested.
Malulawa, that's so encouraging and that's so clear. Thank you. And thank you so much for putting everything in context for Pacific people in all the public announcements. It's been really wonderful for us.
Prime Minister, Sella here from Radio New Zealand.
Sella, go ahead.
How concerned are you about the misinformation in Pacific communities, and how do you want to counter that?
Yeah, well, actually, we've been concerned about misinformation just across the board, and it has been across the board, and that's something that we saw in both our first wave, but also we have seen in our second. One of the things that, of course, we've tried to use is use multiple platforms to try and communicate across different forms of media, the really important messages to help make sure people are kept safe, but particularly combat messages that might act as a barrier for people to going and getting a test. For instance, testing is free. When we take people's information, actually your visa status or any other status is not collected, it is not checked. There is no barrier to testing, and people should feel they can safely come forward. Also, we've been concerned that we've heard that some people fear that they might lose contact with their family if they are a positive COVID case. We've been working hard to address that. We do try and, of course, make sure that we keep families safely together, whilst also making sure that we don't have long chains of transmission that also are very difficult for whānau as well. So wherever we hear misinformation, we've tried to address it. But also, we do need to use those channels that we have that aren't just politicians and our medical specialists, but those within our community as well.
And what reassurance can you give Pacific people who, for some, are actually facing the stigma of not getting a test done after what has happened to the Auckland family cluster?
You may have seen that I spoke very strongly today for that very reason when I heard reports of those family members being, essentially pursued. I had a very strong reaction to that. Where would we be right now if that family hadn't done exactly the right thing and been tested? They have potentially saved lives by doing that, because that helped us identify we had a resurgence. That helped us keep others safe and them safe. They are part of our solution, not part of our problem. And so I'll keep sending that message strongly. People who say anything to vilify others who come forward for a test or who test positive, they're the problem. And that's what I hope we all remember.
Could I
After you, Justin, go for it.
Sure, I'm Justin Latifi from the Spin-Off. Just the question, has the Prime Minister, have you been in touch with the family at the centre of this latest cluster?
No, I actually, I don't know, Justin, the names of people that are involved, of course, generally speaking. Obviously, there's been some cases where media reporting has identified individuals, but I wouldn't hesitate to send a message through those who are working of my gratitude for what they've done, because they did the right thing. I am also hugely disheartened by what they've had to face as a consequence, and so we need to make sure we continue to support whānau regardless of the circumstances, because we would all be worse off if we have a situation in the future where anyone hesitates to come forward.
Could I just ask, is it worth keeping community testing stations open for much longer in South Auckland, given so many South Aucklanders work in border-related type industries?
Yeah. I'll hand over to Dr. Bloomfield for the general question around community testing stations. It might be helpful, though, just in case you'd like the number, that we've had 22,885 Pacific people tested. The percentage of tests that are from Pacifica people in relation to tests has been 23.2%. And of course, New Zealand's population, Pacifica population, is obviously less than half that. So that gives you just a little context for that testing. The one thing I would say is that for our border testing, we will have a strategy that specifically supports those border workers, so it's very easy and accessible for them. We did have a system previously where we were relying on them to go to community testing or GPs. We want to make it easier than that for our border workforce. So we will have something separate for them, but I'll let Dr. Bloomfield speak to community testing.
Yes, so thanks, Prime Minister. Just one additional comment, as the Prime Minister said, a number of a good proportion of those border workers and also some of the workforce in the MIF hotels that have been used in the quarantine hotel are Pacific. And so we're getting a program of testing, of regular testing underway for all the workforces in those settings, so it will be easy to access. In the community, there has been access through general practices and through some permanent sort of CVAC sites. And what the DHBs have done, of course, over the last week and a half is greatly increase access through pop-up clinics and also mobile testing. We will continue those for probably at least the next week to make sure we continue to get good testing rates, and then we'll look and see what the need is after that to make sure that there is the level of access that is needed for Pacific communities, and also that there's this really clear messaging that testing is free. Whether it's with your GP or at a CVAC, or if it's through one of those mobile testing units.
I've got a question. It's John Pulu here from Tangata Pasifika. I've got a question around this morning. A senior Pacific doctor was asking or urging government to have a Pacific voice in the small team with your testing regime. Maybe Dr. Bloomfield, you can answer this. He's basically asking if a Pacific doctor could be part of that team, your testing regime.
Dr. Bloomfield, shall I? Because I spoke with Minister Hipkins, who'll be talking a bit more about the membership of that wider group very shortly, but I can give you an absolute assurance there will be a Pacifica voice in that group.
Mahalo. Also, Prime Minister, while I have your attention, ma'am, what other conversations have you had with our Pacific leaders about obviously allowing the borders for flights from the Pacific, because they're really urging for this travel bubble from the Pacific to Aotearoa?
Yes, and those voices have obviously been consistent all the way through the period where we've had these border restrictions. I think they've demonstrated again why they have been important. I feel like I carry a burden of responsibility to make sure that I do my best alongside all of our health team to look after the health and wellbeing needs of those who are here in New Zealand, but I also feel a responsibility for our Pacific neighbours and what we may inadvertently share with others. And so measles, was a huge lesson for all of us around the close connection between our communities and the responsibility we have collectively to keep one another safe. So that's the lens that I view our border restrictions. Obviously, one of the bases on which we've made decisions about opening up has been to be free of community transmission for 28 days. So we're not there at the moment, and so therefore that will affect any border reopenings with realm countries.
My Lord with the Prime Minister, thank you for the opportunity.
Thank you.
So just on
Brother.
the
Sally, yeah.
specific overstayers topic,
Yeah.
are there concerns that people's immigration status might also hamper contact tracing,
Yes.
given this cluster here in Auckland?
Yes. So that is something that we've specifically, actually before this cluster, something that we've preemptively discussed with particularly our Pacifica representatives in Parliament and our ministers. They've wanted to make sure that there's no barriers to any members of our community, particularly being tested. So testing's where we've had a big focus. And so that's why you'll see we've been talking about this messaging around it being free and that it's regardless of status. So you do not have to have a legal status in New Zealand to be tested, and it does not link to any immigration authorities or so on. So that is completely distinct, and there is no repercussions for being tested there. And so that equally for contact tracing. There's just no connection whatsoever, and we will keep making that point so people feel safe. Dr. Bloomfield, do you want to add to Zilla's question there?
Just one comment I would make, and we were talking yesterday with Don Matheson and also the public health doctor who's leading the response at Auckland Regional Public Health Service, that one of the most important things the public health team do first up when a new case is identified is talk with those people and establish the relationship, and this is a relationship of trust and an understanding, I think, from those whānau that this is a public health response. It's not an enforcement response. And so I think that, as well as coupled with that close working between our Pacific staff, the DHB and other Pacific provider staff on the ground, so actually reaching out face to face to those families, getting that relationship of trust. And then I think that helps overcome that potential barrier you've identified of people who may be concerned about their immigration status to actually be part of helping to solve this puzzle and also be involved in the contact tracing and isolation.
We've also had all of our advice translated into 9 Pacific languages, and the Ministry for Pacific Peoples have been working with the All of Government group to make sure that that information is being shared widely in first languages, Pacific languages. We're also, of course, using every channel that we can to try and get those messages out. Yesterday, I went over and visited the Ministry of Health and saw firsthand the role of our Pacifica team there, and Geraldine here is on the call, to make sure that our contact tracers are able to, first and foremost, build those relationships, have those conversations, and overcome any language barriers as well when they're making contact with families.
Do you have any data on the uptake of the contact tracing app in South Auckland, and how does it compare to elsewhere?
Justin, a good question. I haven't had a breakdown, and I'm not sure whether or not that is. Well, probably actually it could potentially might be a manual request, that one, but we'll put it to our team because I can't answer that off the top of my head. What I can tell you is the uptake of the COVID Tracer app has been significant. We have, from recollection, over doubled the uptake with the downloads, but it would be interesting to know which communities we're reaching.
And what will be done to encourage South Aucklanders to continue to use the app? Is there any kind of specific campaign around trying to engage Pacifica or South Auckland people to engage with the app?
Yeah, well, so I would actually, that might be a question for some of our team who have been working on a social media campaign in particular, using a range of different personalities to communicate some of our COVID-specific messages. And I think it would make sense if we identify, first of all, any barriers to using that app. We are making sure businesses, of course, have the app on display, but I also think it would make sense for us probably to go out and do a little bit of work in the community on that. Geraldine or the team from MPP, that might be something that you might wish to comment on.
Sorry, we had emerging problems here. No, Prime Minister, I think those are really good questions that we will go back and look into and hopefully provide back through our daily 2 o'clock update that we do with PMN Media. I'm not sure, Anik, if you...
Yeah, thanks, Prime Minister. So we definitely have a campaign that's specifically reaching our Auckland community around testing, ensuring everyone's testing, wearing a face covering, and a range of things. And those messages are being carried by key Pacific leaders and stars from the community. So it's by community for community.
Awesome. But Justin, you make a good point. We'll have a little look at what we're doing specifically around the COVID app as well. We've also been having conversations with our church leaders in particular. We've had to reach into a number to reach members of congregation, and so learning a lot around what we can do to make sure that we enhance that record keeping. So in the future, we just make it a little bit easier to reach community there too.
Just to follow up on that, actually, we just had a story on our site about a group called the Cause Collective, who just held a meeting with youth pastors in South Auckland last night. And is there any thought to engaging with local NGOs as a way to actually meet some of the social and challenges that are faced by South Auckland, particularly given Auckland Council is now going to be pulling back from a lot of service delivery due to the budget cuts that they are under? Is there ways that government can support local NGOs more, particularly given Auckland Council and groups like the Southern Initiative are having to pull back from service delivery?
Certainly specific on the COVID response, we saw very quickly that we wanted to make sure that there was enough funding available, particularly for Pacific providers, and for them to deploy that quite quickly too. So when I visited South Seas, seeing there the fact that they were able to use young people, the Bubblegum Initiative, to reach out directly to other young people in the community very, very quickly, because we gave that level of flexibility and the financial support that was being provided to providers on the ground. Also, I understand that DHB and MPP, they are holding daily meetings with churches and providers like Cause Collective. So hopefully all of that means that we're really working collaboratively on responses and making sure that we're putting resource where it will make the biggest difference. Geraldine?
Yeah, can I just add to that? So the Cause Collective are a really fantastic organisation that's working really closely with counties Manukau DHB and Auckland DHB around the system design and linking with communities, particularly our youth community. We're really happy to have them on board because they also run the Prepare Pacifica website, and they're putting information up daily, including the information developed by the Ministry for Pacific Peoples, but also just gathering insights on the ground from various people within churches and just leaders in our community. So we're really engaged well with the Cause Collective and many other organisations. They are facing strain, and we're just looking at how we might be able to support the workforce to really to maintain themselves through what is going to be a long period, but we're actively looking at how we can do that.
Thanks, Geraldine. Just signalling that we've probably got about 5 minutes, so I'll just make sure I pick up other questions that might be out there.
I've got a question, Prime Minister. My name is Lorenzo Kaisara, and I'm from Total Healthcare PHO, and PMN Samoa on 531 PI.
Aye.
A lot of consistent messages are needed. Two messages are coming out to us. One is only do COVID tests if you have symptoms. Second, get tested regardless if you have no symptoms. Now, because Pacific are high risk now, because of current cases and community transmission, should we not be telling all our people to get tested whether they have symptoms or not?
Sounds like a question for a doctor, so I'll ask Dr. Bloomfield to answer that.
Thank you, Prime Minister. So, yes, at the moment, very clear, get a test if you have symptoms. And if you're going to see a GP, of course, I think, as you would appreciate, ring ahead just to make sure they know you're coming, or ring Healthline up with advice if you don't know where the local testing centre is. The only testing they're doing at the moment of people without symptoms are our people who are working at managed isolation facilities. They've virtually all been, to a person, been tested over the last few days. Likewise, our workers at airports and ports, and also some people who are tracked and traced through being contacts, either close contacts or casual contacts. but in that case it will be on the instruction of the public health unit. But for the general population and the general Pacific population, it's get tested if you have symptoms.
And of course, if you go to your GP, it's free as well. It's one of the messages that we keep sharing, because that's something that can be a bit confusing as well.
My final question for Ashley is, people in the Pacifica community respond positively to messages that are directly of relevance to them. It would assist us all to know the breakdown of ethnicities affected in this current cluster in South Auckland. Could you release the number of Samoan people and other Pacific ethnic groups affected? If no, why?
Look, thanks for that. I'll go back and check with the team as to whether we have that second level breakdown by actual different island group in our Pacific ethnicity, and be happy to make that available. Yes, if you as you've suggested, we should be able to get that, and we'll make that available.
May I just
Prime Minister, can I jump in?
Oh, sure. 1 second. I'll just let Geraldine, perhaps. I think she had something to add on that, and then I'll come to you. Was that Tauraki?
Yes.
Great. Go ahead, Geraldine.
Apologies. So just on the numbers, one of the issues is we have got that second level data, but as you'll appreciate, our numbers are still quite small, and we're a very connected community. So we just have to make sure that we maintain the confidentiality. And as the Prime Minister has mentioned, that some of our families have been vilified for coming forward instead of celebrated. So we have got the data, but I don't think we're at a point where we can release it because it's still too small.
Okay.
Hey, thanks, Andrew.
Thank you, and Tauraki.
Thank you, Prime Minister. And before I go on, congratulations on a good job that you guys are doing. I'm from PMN, the Cook Islands language producer. My question is directly to the cooks. In terms of economic recovery, we've relied so much on tourism. And my question is, has there been any talk about fishery management with the cooks, New Zealand and the cooks working in partnership, and as an option to tourism?
Okay, so as an alternative source of economic prosperity? No, we have continued. Of course, we've had conversations around what support we can provide as a close partner with the Cook Islands, because we absolutely recognise that that has been a dominant source of economic activity within the Cook Islands, and it of course was one of the reasons, alongside our realm relationship, why we were looking to expedite travel between the two of us. I haven't had the chance to speak with Prime Minister Puna in recent days, or since we've had the outbreak, but I have been keen to do so, not least because of course it changes the timeline that we're working to around our arrangements, but I'd also really like to hear what his thoughts are on ongoing status of the Cook's recovery and what we can do together. So it will be something I imagine I'll talk to him about very soon.
Yeah, I only brought because when we look at fisheries today, there's a problem with missing observers on the boat and the harvesting of the resources. That's why I brought up. The other question I wanted to bring up is, with the number of health referrals coming from the cooks over the past few years, has that had any effect on New Zealand's thinking on border controls, border issues?
Health referrals?
Yes, because over the years, I believe there's been a lot of health referrals from Raro.
Yes.
It's like every flight, there's a referral.
Yeah.
Has that had any impact on how you look at border issues?
No. Essentially, our border issues in this COVID environment have simply been based on, the question of when is it safe for us on both sides to open? Can we assure ourselves that New Zealand would not be exporting or importing cases, because no one wants that situation? So no, the fact that we have that close health relationship has not predetermined that. It's just simply whether or not we can both maintain COVID-free status when we open our borders.